I also wish to add my voice to my executive director by welcoming all of you to this important press conference on the theme, sale of single sticks of tobacco products to kids or children in Ghana and then across the globe, specifically the African continent. Distinguished guests, ladies and gentlemen, media, civil society present, I wish to welcome you all to this important program. First and foremost, I deem it a great honor to stand before you, to sit before you, today to share with you the results of a study conducted in 10 capital cities, including Ghana. The Vision for Development, in collaboration with its partners, the African Tobacco Control Alliance, the Ghana Health Service, the African Tobacco Control Alliance, that's ATCA. Now, ATCA is a tobacco control alliance established to coordinate the implementation and enforcement of tobacco control laws in the African continent. I would like to first and foremost take this opportunity to commend the efforts of the Ministry of Health, Ghana Health Service, the Food and Drugs Authority, the WHO Country Office, and then also civil society organizations, professional bodies, and individuals, as well as the media, for contributing towards the passage and adoption of the Tobacco Control Act in 2012, that's Act 851, and the Tobacco Control Regulations, that's LI 2247 in 2016. While we commend the efforts of government, ministries, departments, and agencies for the tobacco control laws, that's the effort they have put in it, it is important to draw the attention of government to some gaps that have been identified, making it rather difficult to protect children and youth, especially from the scourge of tobacco industry and the tobacco products. The tobacco control laws ban smoking in public places, except in a DSA, that's the designated smoking areas. Unfortunately, however, nobody within the industry, that's the restaurants, hotels, public places, are adhering or making their facilities to comply with the tobacco control laws. The Food and Drugs Authority have done pretty well by posing signage with instructions, no smoking in these areas in many places. So we go to other places like some of the hotels, go to Accra Mall, you have some signage there clearly showing that you don't have to smoke in this area. So that's an effort that we commend them for. The newest trend in the introduction of shisha, or water pipe, which I'm sure most of you are aware of, is a tobacco product which is being accepted by many of our youth today. Shisha is far more dangerous than traditional cigarettes, and because of the shisha pipe and water inside the device called shisha, it contributes to the spread of infectious diseases and communicable diseases as well, such as HIV and AIDS, tuberculosis, and hepatitis, etc. According to the Global Youth Tobacco Survey conducted in 2009 in Ghana, 12.5% currently use any tobacco products. I'm talking about the age between 13 and 15 years old. This was conducted by Ghana Health Service in 2009, though it is old, but it's still relevant. And out of the research, 14.1% of males smoke cigarette or have ever used any tobacco product, and then also 10.6% of females has also tried or used any tobacco product. It is, however, sad to note that every year, more than 3,400 of people in Ghana are likely to be killed by tobacco and cause diseases, while more than 53,000 children and more than 75 adults continue to use tobacco each day, according to the Tobacco Atlas. Distinguished colleagues of the press, this study that we are talking about today was conducted and undertaken to understand whether sale of single stick of cigarette products exists within countries, how single stick of cigarettes and marketing mechanism may be similar and different across the countries. Here I'm talking about the countries that this study was conducted. And finally, whether it was possible to detect common tobacco industry practices to support single sale of tobacco products. So our main focus here is to look at how children are exposed to tobacco products. Now it is clear, however, from the study that was conducted in all the 10 capital cities to the effect that single sticks are readily available, sold and consumed in all 10 capital cities included in this research work. Aggravating the problem to tobacco advertising that is usually present where single sticks are sold. So it means that wherever single sticks are sold, you still have the tobacco industry, trying to still expose or advertise their product. Meanwhile, the law of Ghana have banned advertisement of tobacco products. The availability of single sticks of tobacco products allows individuals with few resources, such as the youth and the poor, to buy tobacco products. In addition, the fact that single sticks are widely available and promoted underscores the fact that they are considered as normal. Meanwhile, smoking is a dangerous addictive substance or behavior that can result in death. School children are also exposed to candy cigarettes in the form of cigarettes aimed at encouraging new smokers. There are also open advertisements of cigarette products by shop owners and hawkers near schools, despite tobacco control and tobacco marketing restrictions in the country and many other African countries. Ladies and gentlemen, it is important to note that the British American Tobacco BAT and Philip Morris International supplies free promotional materials to children, to retailers, tobacco retailers, in order to create a brand recognition and encourage individuals to buy their deadly products. Single sticks of tobacco products are problematic in a variety of reasons. Single sticks are cheaper than a full pack of cigarettes and consequently make tobacco more affordable to youth and other individuals with limited resources. What we are saying is that when tobacco products are sold in sticks, it allows for children to be able to buy. As I speak to you now, in Ghana, for instance, when you are having 20 pesos, what is 20 pesos in our economy today? You can buy a single stick of cigarette products. That's the issue we are dealing with today. Now, number two, researchers examining youth smoking in Argentina found that the purchase of single sticks of cigarettes was more frequent among students from poor schools. Again, sale of single sticks of cigarette products facilitate experimentation among the youth who have not yet become regular smokers. It's on record that the tobacco industry want to ensure at least they get new customers, and the new customers obviously will not be the elderly who are not smoking. It will obviously be children who are now, becoming of age. This is one of the major reasons why the tobacco industry vehemently opposes sale of cigarettes in packs of 20 sticks. Now, what we are trying to explain here is that mostly whenever there's a regulation to ensure at least cigarettes are sold in packs, the tobacco industry vehemently opposes those actions. Meanwhile, those actions will seek to protect children from being able to afford single sticks of cigarette products. And as we all know, the majority of people who smoke are the poor, and because of the addictive nature of the product. The sale of single sticks also undermines existing effective tobacco control policies by limiting an individual exposure to health warning labels and lessening the impact of tobacco tax increases on cigarette packs. One of the measures to aid the achievement of the Sustainable Development Goals is tax on tobacco products what we all know is that it will serve, when you increase the tax on tobacco products, as the executive director alluded earlier, it will serve as a revenue stream for government, because already government is talking about the fact that, they need, resources. So we are also, providing free consultation, the fact that they should increase tax on what? A product that has no benefit whatsoever. But what it does is to kill and create a lot of problems to individuals and families. So that when we're able to do that, we'll be able to what? Government will get revenue for development, for tobacco control activities, for issue of NCDs, and also discourage smoking and initiation of tobacco among the youth. Sale of single sticks undermines smokers' effort to quit smoking. One study conducted in Mexico also found that smokers who experience more frequent craving for smoke because of seeing single sticks of cigarettes now are less likely to intend to quit when compared to smokers who do not experience such cues or craving. Now, on the questionnaire and observation that was gathered by data collected during this study, I'd like to take you through a few of them. Now, based on the retailers' questionnaire and observation by data collectors, the following conclusions were drawn. 1. Every capital city covered by this survey, including Ghana, it was possible to purchase cigarettes in single sticks. Meanwhile, our law have already banned the sale of single sticks of tobacco products. Number 2, single sticks were made available for purchase when retailers intentionally open a pack of cigarettes to sell to individuals. Number 3, single sticks were available from cigarettes brand owned by British American Tobacco, Philip Morris International, and then Imperial brands. Now, but for Ghana, most of the cigarettes that were bought in single sticks were from the British American Tobacco. It is typical for retailers to receive many free promotional materials, some of them highlighting the sale of single sticks of cigarettes. Among items that the tobacco industry normally gives out are umbrellas, t-shirts, ashtrays, towels. They also give out lighters. Sometimes they give out fans and then also pens. These are promotional material that they give. Meanwhile, our law in Ghana has banned all of this. Now, ladies and gentlemen, fortunately for us, Ghana has a law regulating tobacco use specifically, and I want you to permit me to walk you through some of the provisions that has banned these actions by some retailers by ensuring that children buy tobacco products. Now, the law has prohibited the smoking of prohibited smoking in public places, including premises in which children are cared for. A person shall not package, label, or offer for sale a tobacco product that looks or likely to be identified or associated with a tobacco product. So clearly, our law have banned some element of tobacco product that looks that looks like a tobacco product. Now, on minimum age restrictions, which is also captured in our law, that is sold to and by minor. It says that a person shall not, 1, sell or offer for a tobacco product to a kid or a child. Number 2, send a child to sell or buy a tobacco product or any tobacco product we have in the system. And number 3, request a child to light a tobacco or a tobacco product. And then finally, expose a child to tobacco or a tobacco product. So what we are saying that even where you find, the tobacco industry displaying their product, and I'm sure you've been seeing all over us. When you move around the market or the street, you find the tobacco industry displaying their products, in front of the shops, and children are seeing it. The more children see this thing, the more they are enticed and encouraged to use them. Meanwhile, our law has clearly said that children shouldn't be exposed to all these tobacco products. And then sale of tobacco products itself. Now, despite any provision of this part, a person shall not sell or offer a tobacco product or tobacco in 1, a health institution, including hospitals, pharmacy, and clinic. And then also any educational institution other than tertiary institution. So it means that you can't sell cigarettes close to or within these facilities I've mentioned, health institutions where children play, and then also around educational institutions, especially where, except in tertiary institutions, though we had a lot of challenge with this provision. But of course, this is what we have now. So what we are calling for is strictly adequate enforcement of what? Of this clause. So our children are protected from the scourge of these tobacco products. Now, display of signs at point of sale. Now, a person shall not sell or offer for a sale a tobacco product or display at a point of sale, or it should display at a point of sale an inscription that tobacco products are available here. And then also, it's also said that the description may be made by way of sign containing only the following statement. Now, we cannot by law sell tobacco products to anyone under the age of 18 years. So it means that if today you go out there and you see a vendor or you see a shop selling a tobacco product, you should see this signage there that we cannot, the retailer must put it there that we cannot by law sell a tobacco product to anybody below the ages of 18 years. But in many cases, you don't find these signages over there. The Vision for Attained Development believes that stringent measures are needed or necessary to provide lasting solution to the problems of selling single sticks of cigarette products to children and exposing them to cigarettes in Ghana and the African continent. The Vision for Attained Development therefore calls on government, specifically the Ministry of Health, the Food and Drugs Authority, and all relevant authorities to take concrete steps based on the recommendations below. Now, number one, in line with Article 16 of the WHO FCTC and the National Tobacco Control Law and Regulations, the Ministry of Health and the FDA should ensure that the sale of single sticks of tobacco products is prohibited with immediate effect. Number two, in line with Article 13 of the WHO FCTC, that's the Framework Convention on Tobacco Control, and the National Tobacco Control Law and Regulations, the Ministry of Health and FDA should comprehensively enforce the ban on all forms of advertising, promotion, and sponsorship, and this should include any advertising or promotional materials related to single sticks of tobacco products. Authorities must also ensure that single sticks of cigarettes are not sold close to educational institutions, and this is where the problem is. We want to make sure at least they ensure that all those shops who are selling cigarette products close to schools, where children will always go and buy, toffees and other stuff, they should ban sale of cigarette products at least close to schools, so that we can have our children protected from tobacco, and tobacco industry. And then also, children playing grounds where children normally go and hang out. We should ensure at least tobacco is not sold, close to those places. And then also ensure that the aspect of tobacco control laws and regulation protecting children are effectively adhered to by the tobacco industry and their retailers. We also want to call on the British American Tobacco and their allies who front for them to ensure that their retailers do not expose and sell tobacco to children. Because this is very important, because when this study was conducted, you go some of the children, they are not even aware that there's a law even prohibiting children from buying cigarette products. And this is a duty for all of us, but we think that one of the responsibilities lies on the British American Tobacco, because they are selling the products in the country. So they must ensure that the retailers are complying with the laws of the country. Now, tobacco is one of the major risk factors for non-communicable diseases in the world today. As such, there is a global call to reduce the NCD burden. And one of the interventions to strictly implement tobacco control laws. Ghana can achieve the Sustainable Development Goals by making tobacco control a national priority and dedicate funds to the implementation of the tobacco control laws in the country. Ladies and gentlemen, there is no reason why we cannot act now to strengthen the implementation of the Framework Convention on Tobacco Control in Ghana. Finally, it is important to note that tobacco is the only legal product in the world today that kills its customers and clients when used as prescribed by the manufacturer. Thank you very much for your attention.